Oh, good. So I just want to finish. There's something, there's a powerful educational tool called modeling, where if you visualize yourself or appear doing something, then you are empowered to do it yourself. And the university's invested a lot into virtual reality. We have a couple of volunteers. Want to come down, Ben? Let's see. Back over here. All right, here, put this on. Dr. Williams, could we have that seat for a minute? Put this on. Have a seat right here. You're not going to be able to see. But we'll project. All right, why don't you carefully put this on and have a seat. So you have to be able to visualize yourself or appear that you know doing this. And again, this is the latest university technology. Okay, now I'm going to be touching your headsets and things, just to orient you. Okay. I'm going to calibrate you first. Then get ready, okay? Then raise your right arm.
That's pretty cool. How the hell's it made?
Go up here. Alright, we're working.
I don't know how it goes.
Now, third person. Again, one of your peers doing this. What you're going to be doing next week, labeled for you.
This is Miss Smarts. She is full code, hospital day 3. Our 23-year-old G1P1 female with history of insulin-dependent diabetes, admitted with diabetic ketoacidosis, postpartum, and a headache felt consistent with post-dural puncture of her epidural. 24-hour events include her anion gap closed last night and is now down to 10. Total insulin in the past 24 hours was 32 units. Symptoms-wise, she states her headache is still 5 out of 10, down from 8. Sitting up still worsens her headache. No vision changes and no fever, nausea, or vomiting.
I saw it right there. So just a quick question. You mentioned 32 units the day before. What was the day before that?
60 her first day and then 45 2 days ago.
So Marion has a trend ready.
Observations. Her temperature max was 36.7. Heart rate ranged from 85 to 104, most recently 100. Extremities had no edema and there were no skin lesions. And she has one peripheral IV that is not measured. Neuro, she wouldn't let me check pupils, but motor strength and sensation to light touch was normal throughout. Labs, white blood cell count 9.3 down from 14.1.
With trends.
H&H was 9.3 over 27.7. The 27.7 is up from 24. Platelets 290. So, assessment and plan. Number 1, her headache is a little better, throbbing, band-like, and positional is consistent with post-dural puncture headache, especially given MRI findings. Unlikely infection given resolving leukocytosis. She remains afebrile. She's NPO in case we proceed with a blood patch this afternoon. The dilaudid and Imatrix aren't helping, so we'll stop those.
Alright, so do you want to do another LP now and look for infection?
Could consider it if she gets worse or has a fever, but I would hate to worsen her headache with it now.
Good.
Number 2, diabetic ketoacidosis resolved. Anion gap closed last night to 10. We'll check a BMP this afternoon to ensure anion gap remains closed. Continue her Foley for strict eye and nose.
Let me just ask you a question. Do you really think that you need to keep the Foley in, given that her renal function is improved, her white counts down? I mean, there's a risk to keeping the Foley in of infection, and somebody right now apparently has a sterile urine, so I would probably not keep that.
Sure. Glucose checks will continue. Number 4, infectious disease. She's on no antibiotics. Leukocytosis resolved. Will follow up on final culture reports. DVT prophylaxis is Lovenox. And Dispo, continue to monitor her on the floor overnight. And if her headache improves, then maybe she can be discharged tomorrow.
Good, let's go in and see her.
Well, not bad for your first time. Round of applause for our trainees. Great job. So you've seen